All right, let's dive right into this explainer and demystify some of the absolute coolest chemical engineering happening inside your body right now. When most of us think about our skeleton, we just picture the static, unchanging frame like the wooden studs inside a house. But the reality of bone and mineral metabolism is that it's a highly dynamic, endlessly active system. It's essentially a master thermostat, constantly reading and reacting in real time just to keep you alive.
So, I want to start off by asking a pretty high-stakes question, because it really sets the tone for everything we're exploring today. What do you think happens if your blood calcium shifts by just 1%? Well, the answer is actually pretty terrifying. Even a tiny 1% dip or spike in your blood's calcium levels can cause life-threatening cardiac issues and extreme neuromuscular complications. Calcium isn't just there to make your bones hard. It is literally the biological spark plug that allows your neurons to fire and your muscles to contract.
Because we're dealing with some beautifully complex, interlocking biological systems today, here's our roadmap. We'll cover the ultimate biological balancing act, meet the hormonal managers, explore the bone, gut, and kidney triad, look at what happens when the balance breaks, and finally, how we fix the system medically.
Okay, starting with part 1, the ultimate biological balancing act. Let's lay down the foundational rules.
Think about how your body stores calcium like a massive financial system. A whopping 99% of your body's calcium is locked securely away inside the crystalline framework of your bones. That's your body's locked bank vault. But it's that tiny 1%, the loose pocket change floating around in your extracellular fluids, that is actually driving all your real-time neuromuscular action. And of that tiny 1%, nearly half is floating completely free and ionized, ready to be used at a microsecond's notice.
And that brings us to this highly specific, absolutely crucial number, 8.5 to 10.2 milligrams per deciliter. This represents the incredibly narrow physiological window of serum calcium that your body has to fiercely defend. Seriously, everything we discuss from this point forward, every single hormone, every organ, exists for one reason: to keep your blood calcium securely locked within this incredibly tight limit. Moving right along to Section 2, the hormonal managers. Let's meet the microscopic regulators running the show.
So it's all about a constant push and pull. On one side we have parathyroid hormone, or PTH. You can think of PTH as an elevator. It forcefully mobilizes minerals the second your blood calcium drops. But on the other side we have calcitonin, which is secreted by your thyroid gland. Calcitonin is the emergency brake. When calcium levels spike too high, it binds directly to the osteoclasts. Those are the cells responsible for destroying bone, and strictly tells them to stop working.
Now let's look at our primary absorber, vitamin D. It actually builds up through a very precise 3-step activation cascade. It's like an assembly line. Step 1, you get raw, basically inactive vitamin D from the sun or your diet. Step 2, it travels to your liver where it gets converted into 25-hydroxyvitamin D. But the real magic? That happens in Step 3. Down in the kidneys, the 1-alpha-hydroxylase enzyme acts as the final ignition key. It turns that inactive form into active calcitriol, which is what actually powers the absorption of calcium in your gut.
But wait, there is a crucial fourth player here, and science has only recently really mapped this out: fibroblast growth factor 23, or FGF23. What's absolutely wild about this is that your skeleton isn't just some dead scaffolding. Your bone cells themselves secrete this hormone to literally talk back to your kidneys. Its main job is to aggressively promote the excretion of phosphate in your urine and suppress that active vitamin D we just talked about. Basically, it makes sure your phosphate levels don't dangerously skyrocket alongside your calcium.
All right, Section 3, the bone, gut, kidney triad. Let's take a walk down to the factory floor.
At the most fundamental level, you have this flawless, real-time communication loop. Imagine a thermostat. If your blood calcium rises above that tight set point, the thyroid gland immediately hits the calcitonin brake. But if calcium falls below the set point, those 4 tiny little parathyroid glands sitting right on the back of your thyroid detect the drop and they smash the PTH elevator button. It is just a continuous, non-stop feedback loop. Zooming in a bit closer, PTH is essentially the boss sitting right at the center of the bone, gut, and kidney triad. It acts directly on the bones to increase resorption, literally mining your skeleton for calcium. At the exact same time, it tells your kidneys to hold on to calcium so you don't just pee it out. And, maybe most importantly, it stimulates that active vitamin D in the kidney, which travels down to the gut to trigger the genetic encoding of calcium channels.
Specifically, it builds a cellular doorway called TRPV6, which lets you absorb calcium straight from your food.
Which brings us to Section 4. When the balance breaks, what happens during a system failure? Let's contrast the two extremes here, because things get serious fast. When calcium drops too low, that's hypocalcemia, the voltage-gated sodium channels in your nerves become highly unstable. They start firing completely spontaneously. We're talking painful muscle spasms, facial twitching, and tetany, which is where your muscles painfully lock up and you can't move them. On the flip side, when calcium rises dangerously high, hypercalcemia, maybe from a parathyroid tumor, it acts as a massive nervous system depressant, severely slowing down your brain and completely overwhelming your kidney's ability to filter.
In fact, to easily remember the dramatic clinical presentation of severe hypercalcemia, medical students use a really punchy mnemonic: stones, bones, groans, and psychic moans. Stones stands for kidney stones, which happen because you're filtering way too much calcium. Bones stands for fractures caused by continuous mineral leaching from the skeleton. Groans refers to severe abdominal pain and constipation. And psychic moans represents the severe neurological symptoms, confusion, and depression that can set in.
Finally, Section 5, Fixing the System. Let's look at our medical overrides. For basic mineral replenishment, we usually turn to daily supplements. But it's definitely not a one-size-fits-all situation. Calcium carbonate is great because it yields a lot of elemental calcium, about 40%, but it absolutely requires strong stomach acid to dissolve. So if you're treating an elderly patient or someone taking acid-blocking medication, you have to switch them to calcium citrate. It has less raw calcium, sure, but it's highly soluble in water and doesn't rely on stomach acid at all to do its job.
Now, for serious conditions like chronic kidney disease or severe osteoporosis, we have to use some brilliant pharmacological hacks. Take alpha-calcidol, for example. It's basically pre-activated vitamin D that completely bypasses failing kidney enzymes. Then there's teriparatide. We know continuous PTH tears bone down, but we figured out that if we pulse the system with intermittent synthetic PTH, it actually tricks the body into building brand new bone. And finally, cinacalcet. This is a calcium mimetic that literally tricks the calcium-sensing receptors on the parathyroid gland into thinking there's plenty of calcium around, which shuts down runaway PTH production.
So, I'll leave you with this final thought to ponder. As we wrap up this explainer, consider the silent, continuous remodeling happening inside your own skeleton at this very moment. You have invisible chemical managers furiously breaking down and rebuilding your bones, molecule by molecule, maintaining a completely perfect balance just to keep your heart beating and your muscles moving. Are you giving your biological thermostat the raw materials it needs to keep running flawlessly? Keep thinking about that and never stop exploring the incredible machinery of the human body.